Dr. Robert Mathew. I am a Chief Neurologist of Anugraham Neurocare in Trivandrum, Kerala. Today, I'll be talking about epilepsy, a very important topic. Can I get married if I am having epilepsy? Can I have children if I am having epilepsy? The answer for both of this is yes. Widely stigmatized one. People think that they can't marry and they can have children. Definitely not. The epileptics have the same potential to marry, to have a successful married life, and to have children as those without epilepsy. However, it goes without saying that the epilepsy patient needs more attention and care. So I would say with more additional attention and care, patients with epilepsy can have the same type of married life as others and can have normal deliveries like those without epilepsy. So what are the special things that has to be taken care of? So when you plan a marriage, you have to discuss with the neurologist in advance. And some precautions have to be taken to prevent congenital anomalies occurring in the fetus or the baby. And the preparations has to be done even before marriage. Like the first thing will be to make sure that the epilepsy is under control. So the dose of the medicines have to be what is called optimized. The best possible dose to control seizures has to be arranged. Or the medicine may have to be changed. Some medicines are not good for the child or for the fetus. So that may have to be changed. So you need time for these things. And these things are best done before the marriage. And usually from day one of marriage, a vitamin tablet has to be taken so that will also protect the fetus from having congenital malformations. The risk of congenital malformations in the fetus in somebody with epilepsy will be something around 4%. And the risk of congenital malformation in somebody who doesn't have epilepsy is 2%. So it's more or less very close. However, certain tablets, maybe the one to be remembered is sodium valproate, can produce fetal anomalies at a very, very high frequency. They are at high risk of producing fetal anomalies. So that sodium valproate has to be changed. Now, having had the seizures under control as far as possible, they can get into normal sexual life and they can get epileptic women can get pregnant. And all throughout, the anti-epileptic medicine should be continuously taken. Some people stop the medicine when they think that they are pregnant, which is a wrong thing. And in some medications, the drug level has to be monitored because it changes during pregnancy, and some adjustments have to be made for the drug level. And the medicine has to be continued all throughout the pregnancy. We have to make sure that the patient doesn't get seizures during pregnancy. And during delivery, usually there won't be additional complications. However, we have to be careful, and delivery is best done in a place where there is a neurology service also available. In the unfortunate event that there is some seizures, some injections, lorazepam injection can be given and it can be kept under control. And the child has to be monitored very closely for congenital malformations. A couple of special tests may have to be done. And after delivery, again, the drug levels may fluctuate. It may just go up and come down in a few days. So you may have to sort of modulate the drug level. And then about breastfeeding, many of the drugs are fairly safe and with caution. If you select the drug, then breastfeeding also is possible. And other weapons and all will be same. Child may need some extra monitoring for congenital malformation and then some learning disability. We have to specifically look for autistic features. So little bit attention has to be done, but patients with epilepsy can have a normal pregnancy, normal married life, normal delivery. Thank you very much for a very patient.